Hello everyone. In this video, I will explain the FIGO staging and management of carcinoma endometrium through a very easy diagram. But first, let us look at a few points about carcinoma endometrium. The most common presentation of carcinoma endometrium is irregular vaginal bleeding or postmenopausal bleeding in women who have already attained menopause. Other than that, the patient may complain of brown discharge, pyometra or pus in the endometrium, and pain in the hypogastric or bilateral iliac fossa regions. When a postmenopausal female presents with bleeding, the first investigation to be done is a TVS or a transvaginal sonograph. In that, the endometrial thickness is checked. If the endometrial thickness is more than or equal to 5 millimeters, then an endometrial curettage is done. This is the investigation of choice. The gold standard investigation is a fractional curettage. Investigations like MRI indicate whether the cancer has spread to the lower uterine segment and cervix, and CT indicates metastasis, pelvic metastasis, and lymph nodal involvement. Now let us look at the FIGO staging, which is divided into 4 stages. The first stage involves only the myometrium of the uterus. Stage 1A is when less than 50% of the myometrial thickness is involved. Stage 1B is when more than 50% of myometrial thickness is involved. Management of both stage 1A as well as 1B involve total abdominal hysterectomy as well as a bilateral salpingo-oophorectomy. In 1A, if tumor margins are less than 2 cm, then no lymph node dissection is done. But if the margin is more than 2 cm, pelvic lymph nodes are also removed. In 1B, pelvic as well as para-aortic lymph nodes are removed. Along with that, radiotherapy is also administered. Involvement of the cervical stroma is stage 2. The surgery done for this stage is Wertheim's hysterectomy. In Wertheim's hysterectomy, the uterus, cervix, parts of the vagina, and the surrounding ligaments are removed. Along with that, the pelvic and para-aortic lymph nodes are also removed, and radiotherapy is administered. Involvement of the adnexa is stage 3A. Adnexa is the area surrounding the uterus in which the ovary and the fallopian tube are present, along with the ligaments and vessels. Stage 3B is involvement of the parametrium along with the vagina. Stage 3C is characterized by involvement of the pelvic and the para-aortic lymph nodes. Stage 3 is treated by a debulking surgery. In debulking surgery, all the involved structures are removed along with pelvic as well as para-aortic lymph node dissection, and along with that, chemotherapy and radiotherapy are also given. Stage 4A is characterized by involvement of the inguinal lymph nodes. Stage 4B is presence of a distant metastasis. In both of these cases, a debulking surgery is done along with removal of pelvic as well as para-aortic lymph nodes, and chemotherapy and radiotherapy are administered.